is proud to announce the formation of a partnership with the March of Dimes. The mission of the March of Dimes is to improve the health of babies by preventing birth defects, premature birth, and infant mortality. Fighting obstetric thrombophilia fits squarely within our joint missions. By working together, the Shane Foundation and March of Dimes, along with your support, can improve the lives of mothers and babies through education and research to prevent the harmful effects of thrombophilias in pregnancy. Together, we will be raising public awareness, working with the obstetric community, and funding medical research. Our initial educational plans include updating the existing March of Dimes website and resources on obstetric thrombophilia. In addition, the March of Dimes will seek opportunities to partner with medical professional groups, such as the American College of Obstetricians and Gynecologists, to educate health professionals about research and clinical practice related to thrombophilias in pregnancy, utilizing support from the Shane Foundation. A link to the Shane Foundation website will appear on the March of Dimes thrombophilia section. I would like to invite Alyson Sprafkin to join us. She's from the March of Dimes, and she's going to introduce herself. Thank you.
Hello, can you hear me? My name is Alyson Sprafkin, as Robyn introduced me, and I am here on behalf of the March of Dimes. I work for the Greater Los Angeles Division, and I work specifically with our mission families which are families who have been impacted specifically by the work that we do. So let me first say a huge thank you to the Shane Foundation for finding us and for having us here tonight and for so very generously donating the funds raised here to our organization. I'm incredibly humbled and honored to be here as a representative of the March of Dimes, and as a mom myself, when Robyn told me Shane's story, it's so unthinkable, and it's so amazing to me and to the March of Dimes that you've really created such an amazing organization as a way to sort of help others to not have to endure this. So first of all, just thank you, and thanks to all of you for being here. As Robyn mentioned, the mission of the March of Dimes is to improve the health of babies by preventing premature birth, birth defects, and infant mortality. And as has also been mentioned tonight, thrombophilias are one of the leading threats to maternal and baby health. And the March of Dimes is the largest organization dedicated to mom and baby health. And as that is the case, a threat like thrombophilias is simply unacceptable. We are so happy that we'll be able to use the money to fund the research and the education and to spread awareness about this issue, about this disorder, and about its threat to mom and baby health. I've found through my work with March of Dimes and through my own personal experience that often the lack of awareness is what is so critical. And it's pretty clear to me that Robyn and her family that they're on that page, and that the March of Dimes will help to hopefully increase that awareness and thereby hopefully help to save many, many moms and babies from having to endure this sort of pain. I'm so excited about the partnership. I'm so honored to be here, and the March of Dimes, what we at the March of Dimes always say is that we really can envision a day when all babies are born full term and healthy, when all moms have healthy pregnancies, and this will go a long way to helping to make that dream a reality. So thank you all for being here. Thank you to Shane Foundation for finding us and for helping to fund the work that we do. Just thank you.
A few months ago, I visited a new gynecologist, and I told her Shane's story. And I asked her if she knew of any doctors who treated women like Shane. I had thought that these doctors were extremely difficult to locate.
But she said, well, yes, of course. Right here, next door, I know someone who does this every day. So it's been absolutely wonderful to find a doctor literally just down the street who completely understood everything that happened to Shane and who devotes a large part of his life to treating pregnant women with some of the same health issues. So now I'm very pleased to introduce our medical advisor, Dr. Waleed Doany. Dr. Doany specializes in maternal fetal medicine. He was a clinical professor at UCLA, where he conducted clinical research in high-risk obstetrics. The UCLA residents awarded him Best Teacher of the Year, so I was very impressed by that, because I'm a teacher. In 1998, he established his own perinatal group, Comprehensive Maternal Fetal Medicine Consultations, in Tarzana. In conversations with Dr. Doany, I have been particularly impressed with his passion for empowering women to take a more active role in understanding risk factors that may impact their pregnancy. So I'm just thrilled that the doctor is with us tonight.
Good evening, everybody. Sorry, it's been a very long day, but I'm thankful to be here, and thank you for the introduction. I have been a high-risk obstetrician for approximately 26 years, and over these years, unfortunately, Shane's story is not particularly very special, and that is what's very sad about it. Worst of all is that the incidence of stillbirth is approximately 1 in every 126 girls. So you could imagine in a country like the US, when we consider ourselves a developed country, that we actually accept such statistics, and that we actually choose to describe ourselves as a developed country. Before women actually reach a point where they make as much as men for the same profession and the same services that we provide, we are never going to change the mentality of the medical services towards women. And women also must empower yourselves with understanding what it takes before you engage in oral contraceptive use or before you get pregnant. It is our job in the medical industry to help you with that, but we have failed. We have failed on many fronts, and we should take responsibility for that failure. On a yearly basis, I have 4 or 5 patients who walk in and they've lost a baby. I was not taking care of them during that time. And when I look at the medical records, I'm ashamed. Because none of these families deserve such an outcome. If any of you have problems, I was probably 5 years old when my father died right next to me. We were in Copacabana in Brazil. He had a brain bleed, something today that is treatable on an outpatient basis. Science works wonders when we pay attention and when we work towards improving care. But we have to care to do that. So when I did receive the first email from Roberta, the first thought I had was, somebody wants to get pregnant again and a baby died. I had no idea really what happened until I spoke with her, and I was very ashamed and I was stunned. So now, from that tragedy, we have this incredible Shane Foundation, and we have the incredible chance to work with the March of Dimes. I'm usually not this emotional. I was worried a little bit about this issue, but in general, when I sit one-on-one with my patients, I'm now a little bit more careful with this issue. It's hard because if we are looking square at the facts, we have known about the issue of acquired thrombophilia since the 1970s. We have seen pregnant women with complications ever since my early fellowship years in 1982. We have neglected to discuss the risks of smoking and obesity and surgery all as they pertain to this issue of thrombophilia and how they can influence fetal outcome, maternal outcome. And as a culture, we have focused primarily on the needs of men between the age of 40s and 60s. So now we have to make an effort to change that, and you all have to help. So where do we start? I agree fully with the idea that we have to start first with the education and awareness. Public education is very important, but so is medical education. The societies frequently review issues of thrombophilia, but we are very behind in the science. Though approximately 10 to 15% of the population carry either acquired or inherited thrombophilias, only a small fraction of these women end up having severe complications. And we still don't know how to figure out which fraction. And that is where we fail. And this is where we have to focus to succeed. And in order to do that, we need scientists. We need you to encourage your kids to get into science. And we need you to also help with funding the foundation such as this, so that hopefully we find already research centers that are interested in this field, and we can help direct them into looking at why such a big difference between the women who have the same condition when it comes to pregnancy or the use of all contraceptives. There are techniques that we currently use in early pregnancy that are still not approved in the US as standard, that can help tell us if the uterine circulation is good enough to support the pregnancy. We deal daily with insurance issues not wishing to cover these services. And as long as we don't recognize that fetal life is the foundation of the rest of a person's life, and therefore the future of our country, we fail as a society. Today, I don't want to fail anymore, so I'm here to help. Thank you for inviting me.